in just a second.
And I've been waiting till people arrive, so then I'll start off once we have more people.
Perfect. All right, I'm going to go ahead and start broadcasting so people will be able to see you.
We're just giving everybody a minute to arrive and then I'll begin.
Okay.
Okay, we'll go ahead and get started. Hello and welcome to the second panel of the symposium on the long-term impact of pandemics, ongoing disruptions to society, families, and the economy. My name is Dr. Jessica Howell. I'm an associate professor of English here at Texas A&M University and also associate director of the Glasscock Center for Humanities Research, where I convene the Global Health Humanities Initiative. Some of you may have heard of the health humanities, but if not, I can briefly say that it's a growing interdisciplinary field that uses methods drawn from the humanities and humanistic social sciences to understand the lived experience of illness and healing. Global health humanities may use medical history, the study of narrative or people's stories, and ethical considerations about health equity and health access, just as a few examples, to enter into conversations and collaborations concerned with issues of urgent importance regarding global health. If you're interested in learning more about global health humanities, please visit the initiative website, which I'm about to put into the chat function here on the side. Or please feel free to get in touch with me directly. And we welcome your participation. So on to today's events. We have been very happy to partner with the Scowcroft Institute of International Affairs in organizing and hosting today's symposium, specifically Dr. Leslie Rule, Associate Research Scientist and the Institute's Assistant Director. Dr. Rule is a conservation ecologist who collaborates with a team in the Democratic Republic of Congo. And we were very fortunate to hear from Dr. Rule and her team this morning for the first panel. We also thank the financial sponsor of today's event, the T3 grant in Global Health Humanities from the President's Excellence Fund here at Texas A&M. And for this grant, I, Professor Violet Showers-Johnson from the History Department and Dr. Laura Daig from the Bush School of Government and Public Service have been collecting and analyzing oral histories by those who have firsthand experience with the Ebola epidemic. This project seeds a conversation during the second panel of the day. Finally, after a 2-hour break, we will reconvene at 3 p.m. for the keynote address by Professor Greg Mittman. Professor Mittman is the Vilas Research and William Coleman Professor of History, Medical History, and Environmental Studies at the University of Wisconsin-Madison. His talk is entitled Viral Exchanges, the Shifting Geopolitics of Ebola and COVID-19. For those of you who've registered for multiple events today, and we hope that you've been able to join us and will continue to be able to join us for the for the keynote, you should have received a unique link for each event when you registered. So I will give just a few remarks on today's symposium theme. Dr. Rule and I decided it was important to use the conversations today to make connections between Ebola epidemics and outbreaks, which both our projects study and engage, and our current moment during the COVID-19 pandemic. These connections are meant to be productive rather than reductive. Of course, historical, cultural, geographical, and medical contexts vary widely. However, by focusing on individual and local experiences, we have the possibility, I think, to address important larger questions that cut across both epidemics and outbreaks. So questions such as, what social disruptions to individual society and economies occurred during and after epidemics, especially those disruptions that may not be as widely publicized or known. Further, what happens after international attention and aid leave affected communities? And perhaps we may also be inspired to ask and discuss questions such as, why is the creation of art, such as film or stories, a significant act during and after an epidemic? How do people use these forms of creative expression to make sense of the ever-changing social and medical landscape? We look forward to your contributions, our audience members' contributions to these conversations during the substantial Q&A period that we reserve following each panel's presentation. I'd like to thank the Glasscock Center and Scowcroft Institute staff for their help in organizing, publicizing, and tech hosting today's events, specifically Shannon Godzenbach, the Global Health Humanities Graduate Research Assistant, Amanda Duchek, Brittany Spornhauer, and Lauren Zazuchek. And thanks to the Department of English staff. Finally, a special thanks to our panel chairs, Dr. Leslie Rule and Professor Violet Showers-Johnson, for organizing and facilitating these rich panels, and thanks to our panelists as well for joining us. Before turning over to Professor Johnson, I'll remind us of some of the webinar functions. We are recording today. If you wish to view the webinar using closed captioning or subtitles, please select the CC or live transcript option at the bottom of your Zoom window. You can then adjust the settings and sizes as you prefer. And finally, as I mentioned, we will be hosting a Q&A session at the end of each panel or talk, facilitated by the event's chair. So feel free to ask any questions as they occur to you really during the panel or at the end, directly in the Q&A window. And if you see a question that you would particularly like addressed, you can feel free to like it or uptick it so we know multiple people are interested. So thank you again for joining us, and I'd like to turn over now to our second panel chair, Professor Violet Showers-Johnson.
Thank you, Dr. Howell. Good morning to those of you joining us from the United States, and good evening to those of you joining us from Sierra Leone, West Africa. I am Violet Showers-Johnson, Professor of History and Associate Dean in the College of Liberal Arts at Texas A&M University. Welcome to this panel. I will be moderating this panel, which is on oral histories of Ebola, and we are looking at Ebola in Sierra Leone. In 2013, news got to Sierra Leone that Ebola had reached West Africa via Guinea. This was shocking to almost every Sierra Leonean, because at that point, Ebola was seen as a disease that was confined to Central Africa, that was confined to the Congo region. So it was stunning to almost every Sierra Leonean that heard about it, even though it was so close to Sierra Leone in neighboring Guinea. Many Sierra Leoneans felt that it wouldn't get to Sierra Leone. However, by 2014, Ebola made its evil appearance in Sierra Leone, and it ravaged that country until the end of 2015, 2016, when it was controlled, and we are keeping our fingers crossed and praying fervently that it never comes back again. This panel is about that dark period in Sierra Leone's history. Many people outside of Sierra Leone heard about all the horrendous things that happened, the many deaths. The official tally is close to 12,000. Unofficially, it could be more than that. All kinds of social and economic disruptions, especially to the medical community. A country that had few doctors to start with, Ebola came and took some of their most qualified doctors. So people were talking about all of these things. This panel will address some of what people were doing and saying. But all of this was not confined to Africa, to Sierra Leone. Many of the same conversations were going on in the diaspora among Sierra Leoneans. That is why this panel, as it were, is a tale of two cities. We will be looking at oral histories, what people were saying and doing in Freetown, Sierra Leone, as well as in Dallas, Texas. So I will go ahead now and introduce our panelists in the order that they will appear, but I will go ahead and do all three introductions before they begin their remarks. I will start with Freetown, where we have Mr. Jeremiah Harding. He is right there sitting in lovely tropical Sierra Leone, where the weather is so much nicer than what we are experiencing in College Station today. Mr. Jeremiah Victor Harding is a Planning and Quality Assurance Officer in the College of Medicine and Allied Health Science at the University of Sierra Leone. He has a Bachelor of Science with honors in Financial Services, a Master's in Development Management, and a postgraduate diploma in Academic Quality Assurance. And very importantly, in December 2018, Mr. Harding served as our most able research assistant in the oral history project for our study on memories of the Ebola crisis. Welcome, Mr. Harding. And our second panelist is Mrs. Yvonne Ayodele Dean. Mrs. Yvonne Ayodele Dean is an award-winning respiratory therapist at the Children's Medical Center Hospital in Dallas. She has a Bachelor of Science from the University of Sierra Leone and a Master's in Public Health from Walden University in the United States. A dedicated and seasoned educator, Ms. Dean has taught across educational tiers. She has taught in a primary school in Sierra Leone. She taught in a secondary school in Sierra Leone. And in the United States, she serves as faculty in higher education public health programs. That's what I mean by she has taught across the spectrum. A naturalized American, Ms. Dean has lived in Texas for over 30 years. She is a founding member of the Creole Descendants Union, Texas branch, and she serves as the organization's current president. Today, she will be talking about this organization's efforts in addressing the Ebola crisis. Welcome, Yvonne. Lastly, but not the least, Mr. Patrick Jackson, or to use his appropriate title, Honorable Patrick Jackson. Honorable Patrick Jackson, an engineer by training, received engineering degrees from State Island University in Staten Island and Oklahoma State University. He also has a master's in science education from Oklahoma State University. Mr. Jackson has pursued a long and successful career in his profession as an industrial engineer, a quality assurance manager, and many other positions for various employers and in his own businesses. He is currently Chief Financial Officer of Emmerich Services, Inc. in Garland, Texas. Mr. Jackson is a well-known engaged member of the Sierra Leone immigrant community and the larger Dallas Metroplex communities. Mr. Jackson has served as the past president of the Creole Descendants Union. I think Mr. Jackson, in fact, was Ms. Yvonne Dean's predecessor as president of that organization. He has also served in a number of capacities on the government of the city of Rolette in Texas, He served in many capacities, including as Deputy Mayor Pro Tem. He is currently the Honorary Consul in Texas for the Republic of Sierra Leone. A naturalized American, Mr. Jackson has lived in America, get this, for more than 50 years. So welcome to these esteemed panelists. We are going to start with Mr. Jeremiah Harding, who will do his remarks about the Ebola crisis in Sierra Leone. Mr. Harding. Unmute yourself, please, Mr. Harding. Thank you.
Good evening, everybody. Good evening, viewers across the world, and another good evening again to fellow panelists. Let me repeat a very sounding amen to what Professor Johnson said in her opening statements, that she prays the Ebola doesn't show itself anymore in this country and even across the world. And just recently, we had a news about its resurgence again in the provinces, but I think that was taken care of. So on the aspect of Ebola in Sierra Leone and Freetown, to be specific, when this whole thing started, it started in the provinces, in a provincial district of Kainlaon or so, yeah, I can remember. And then the news was going around as a rumor that there is a very deadly disease that is in town, and it is moving rapidly from the provinces to Freetown and the entire Sierra Leone. But as rumors are not most times taken seriously, people were not thinking of it as anything serious. In fact, the name alone was so sounding funny that people were thinking that, oh, it's something funny or it's kind of a prank. Until it got so alarming and the effect of it was so dangerous in the provinces where people were not privileged to better health facilities, they were not opportune to better medical attention. So it had a very great toll in the provinces. And so the ministry started taking it seriously, the government started taking it seriously, engagements were being done with international partners and local partners, other medical practitioners, every qualified doctor and nurses. We are getting involved as to how to prevent this thing from entering into the capital city of Freetown. As we all know, the city of Freetown holds the largest population in Sierra Leone. And so when we look at the congestion rates in Sierra Leone, it's so high that a disease like this within will cause a lot of trouble and some great negative impact on everybody. And so it was really, really scary. But it was almost unavoidable that the disease got into Freetown, and so many people were affected. So many people got infected, and the mode of transmission was so easy that it was even impossible for someone to know that he or she will have come in contact with the disease. So it was kind of scary. And so this caused a lot of distractions and disruptions in the social lives of people, in the economic situation of families, individuals, and the country as a whole. And so everything was just geared or concentrated towards fighting the disease. Schools were closed, colleges were closed, businesses were not functioning, people were not gathering again socially, there was no club, no restaurant. And so it was really, really, really serious in Freetown, as Freetown got the highest number of epicenters. In fact, even the established epicenters became overwhelmed with patients that they had to use some secondary schools and some other private facilities to accommodate most of the surplus affected patients. So it was so serious in Freetown. And so everything was so scary. People were so out of normal life, I can say. It's had a very serious effect also on the poverty rate, because people were not engaging into businesses anymore and everything was disrupted. And so when Professor Showers contacted me that they are interested in knowing exactly the impact this has caused in Freetown, this disease caused in Freetown, it was so welcoming and timely. And as I sit here today, I can say I'm speaking now about this disease with the good heart that we are talking of it now as history, because had it been then, it would not have been easy for me to speak about it openly like this without shedding tears, because of what it caused, the death of family members, loved ones, and so. And so putting together the respondents was very deliberate. It was very deliberate to select people who were directly involved, or though everybody was involved, everybody had the impact, the serious impact of the Ebola disease, but it was also necessary to look at some people who actually we thought by then was more than directly involved in this. And so we contacted a matron. A matron is the head of the administrative wing of a hospital. And so we refer to them here as matron. And so she was the head of one of the main referral centers in Sierra Leone, the Connaught Hospital. And so imagine what she would have gone through as a matron when this disease was all over Freetown and Sierra Leone. We also contacted a pharmacist who was, well, before the disease, his pharmacy was located closer to the epicenter, the main epicenter in Freetown by then, which is the Hastings epicenter, the police training school. And so imagine you doing business as a pharmacist closer to an epicenter. It was very difficult for him to even do business in secret, because by then medicines were not allowed to be sold to anybody. Whether you are a pharmacist or not, you have to contact the doctor for any type of symptom that you have. We also contacted a prisons officer, because in Sierra Leone, we know the nature of our prisons, and when such a disease is in town, you have to be very sure of what is happening, even with those people, because their lives also matter. And we also contacted a housewife who was also a pharmacist. And so blending that together, we know what she could go through. And so after that, we contacted a survivor. It was really important that we should have a survivor amongst the respondents, because their views, what they went through, was really necessary to capture in the research. It was not easy to bring the survivor on board, because we know most of these people are going through stigmatization. They are shy to even come out and say, I'm a survivor. So having that perception in the research was very much important. And so we tried to convince her as to why she should come out and give her own perception and feeling about this disease and what she is going through. We also contacted the high school people, because we know schools were not operating, and that was having a very, very negative impact, and a direct negative impact on their upward mobility in terms of promotions. Some girls were not going to school, and so they were becoming victims of pregnancy, unwanted pregnancy, and all this sort. So it was important to talk with them and know what exactly their own story would be. And so we contacted the high school people. And then we also contacted 2 university employees because universities were not operating again. And you know, when the universities are operating, it is based on the fees that students pay that the universities are running. And so if students were not coming on campus, no college was operating, we know how that would tell on even the welfare of the staff. So that was exactly why we deliberately looked at the package of the respondents and see how to put an heterogeneous group together and listen to them. So it was really serious in Sierra Leone. The perception was really that this disease initially was not something to be taken seriously, but it came to the point where the reality was unfolding, and it's really unfolded in a very bad way, that even to go to markets or public places, people had to put on long sleeves. Some people will wrap themselves all over. By then, we did not know about face masks or so, but we are told that the disease will transmit through sweat, body contact, and all sorts. So people are really, if you go to public transport, you see the way some people dressed up, you will know, oh, this is really serious. People are really taking this thing seriously. So that is exactly what went on in Freetown and until the outbreak of the COVID-19. So as we have seen now from the picture, governments together with other partners, the media, journalists, INGOs, NGOs, pressure groups, they put together, they consolidated their efforts to see how best they could raise the awareness. And if we can see people talking, going house to house. The first slide, the second slide, you can see a man going house to house, talking to people in neighborhoods as to how they should prevent themselves and as to how the disease was real. And in the second slide, posters were littered all over the town. You can see posters in every door or every street, every corner that you go, and there are different messages being transmitted. And as you can see here again, this was from China CDC. Every international partners, we are also putting out posters to raise the awareness of the disease. And then the other slide, as you will see, it's those two billboards. We are speaking directly, stop Ebola. And it was everybody's effort to stop Ebola. And also Ebola must go. So these are easier ways for people to understand the efforts that everybody should put together to eradicate or control the disease. And most importantly, there were radio jingles. You know, those radio jingles, they actually helped a lot in controlling the disease. And probably, Prof, you can play it if. Okay, so whilst the audio is being played, those jingles were so important in sending out the messages to every sector, because there was an ultimatum, or there was a condition or so, that the disease, if after 21 days there was no case, then WHO will announce that the disease is no more in town. And so every day people will listen to the radio as to whether there is a case. And if there is a case, even if you are in the 20th day, you will start all over, you start counting all over again. So this got people closer to their radios. And so those jingles were sounding from all angles, and people were benefiting from that. And so the consolidated effort being put together, whether intentionally or unintentionally, whether you are from this side or that side, got us where we had today to speak loudly that Ebola is no more in Sierra Leone. And when this news came out that there is a case, there is a suspected case, everybody was worried, because we don't want to go back to where we were. And so that's exactly the nature of the disease, the Ebola disease in Freetown. It was so serious that everything was concentrated now on Freetown in treating the disease. Professor Showers, your mic is off. Thank you.
Thank you, thank you, thank you. So now let's go on to our second panelist. Let me stop sharing. Okay. Thank you very much, Mr. Hardin. And let's go to our second panelist, Ms. Yvonne Dean. If you, okay.
Good morning, and thank you, Professor, for having me participate in this discussion. It is an international issue. And as Jeremiah has said, he has elaborated a lot and explained all what happened down in Sierra Leone. I believe he would have the most to say in this discussion today because he was there at the base. Thank you for the introduction you make about me. I am excited to be on this panel because my profession requires me to heal, cure, and to do no harm. As Prof has said, I'm a respiratory therapist. So when we heard about Ebola over here in the US, it sent shock through me and fear through me. And I knew it was time for me to do what I love best, to heal, to cure, to make sure people are safe. And fortunately for me, I belong to the Creole Descendants Union and other organizations here in Dallas, Texas. Messages were sent from our global body down to our chapter, which is Creole Descendants Union of Texas, Dallas chapter. Later on, I will tell you some more about KDU. When we got the information that Ebola is in Freetown, in Sierra Leone, and more concentrated in Freetown, we knew we had to do something. An emergency meeting was called, and all the leaders agreed that we cannot waste time. We have to do what we have to do to save these people, to help them out of this situation. Within 2 weeks after we had the first meeting, we were able to connect with other groups. We were able to, at that time, there were only 6 chapters. Now we are about 15. Because we were a 501c organization, we decided to reach out to other big organizations to see what they could do to help us with what's going on in our country. But because all these big organizations have funds that could be disbursed out in only particular time intervals, we couldn't get much because we were late in applying and time was against us. So we decided to collaborate with our members, see what we can come up with, and still continue to reach out. At the time, Honorable Patrick Jackson was our president here in Dallas. And we were lucky to have a very vibrant lady, Miss Waltina Cummins. She was our liaison, our own representative at the global level, and she was able to rally around and get in touch with church organizations so that we could do something. As time went by within that 2 weeks, we were able to connect with Restore Hope, a lady called Betsy Seaborn was able to help us link with some church organizations, and we were able to put packages together. We hosted seminars, emergency seminars, where we would educate people about what is going on. And we were encouraged to send information that we got from CDC and the Department of Health in the United States to our people back home. We made sure that the messages we were sending were on flyers, and these messages, these flyers were translated into the various languages in the country so that people would understand what they were reading. We made the language so simple when we were calling and sending text messages and sending WhatsApp messages so that they would really understand how they could handle this situation. And the main focus was for them to wash their hands, stay away from others who have the disease, and not to disseminate false information that they did not get directly from us or from health officials. As time went on, we were able to, like I said, collaborate with other church organizations, and we ourselves, it was difficult for us, but we were able to dip in our pockets because we know we have to do it for our people. We were able to dip in our pockets and come up with whatever we can. In fact, one of the seminars that we held, we asked people to donate canned goods so that these canned goods were put together in packages and would be sent back home to help people with food. People came to this seminar, they were educated, and we collected more funds again, and we were able to. This is the slide showing when we were at that facility trying to do the packaging to send the goods to Sierra Leone. These are some of the members. You can see Mr. Jackson there, and we were able to, yeah, you can see Mr. Jackson there. We got our kids and all involved. We got members of the community that did not even belong to KDU to come together with us to do this. We forwarded Ebola fact sheets with all the guidelines from our medical specialists here in you can see the label there that were put on the boxes. The conference that we hosted had the topic crushing Ebola as its source. And the source was wherever it came from, now that it is in Sierra Leone, we did not want it to spread. We had this conference at the DFW Sharrington Hotel in October of that year. And like I said, we had canned goods and dried food donation, all of which was used for packaging to send to Sierra Leone. And this was sponsored by Dr. Neil Gallagher. He is the host of Family and Financial Fitness. We contributed to this campaign. And like I said earlier, we had flyers, we made T-shirts, we put our monies together, and a container of about 40 food container was sent to Freetown within 2 weeks. At that time, I was the secretary of the organization, so I was able to know all what was going on. One of the flyers that we sent out was titled Fumble Talk. Fumble Talk meaning we so that correct information will be sent out. There was we also tried to look around to see if we could find out about research organizations that are interested in helping, so that we will see how we could help, because there were organizations beginning to come out that wanted to treat Ebola and to get vaccines. So we were ready to support. We were going all out with flyers. We were going all out to find out who could help us. We partnered with Idea Foundation. We partnered with a church group, forgotten the name of the church group, and Betty Sibon, we partnered with Medisend International. They were able to send this 40-foot container of medical supplies as quickly as possible to Sierra Leone. In fact, prior to that shipment that we did, this Medisend International, prior to that, they had shipped 2 other containers. This was done at a warehouse located in Greenville in Dallas. We were glad we were able to help. And when we heard that this second surge has come and is next door to us, right now we are in panic mode, but we know we will do what we can to help our people in Sierra Leone. They are our people. We have to keep our culture going. We have to help them health-wise. We want them to be safe. So I can tell you, we're ready for whatever comes, and we will help to make our people in Sierra Leone safe from this Ebola presently.
Thank you very much, Madam President of the Creole Descendants Union. I know that in scholarship today, those of us who are in immigration studies, we talk a lot about transnationalism. Here is a very good example of how transnationalism works. Here you have this Sierra Leonean immigrant organization in the United States, Creole Descendants Union, being right at the center of a crisis in their homeland. And to continue with that topic, we now go to Honorable Patrick Jackson. Mr. Jackson, please.
Good afternoon, everybody. Like Professor Johnson said, my name is Patrick Jackson. I'm the Honorary Consul for Sierra Leone to Texas and the surrounding states. When I first heard about Ebola, I'll be very honest with you guys, I was sick to my stomach. For reason being, even though we've been in America for a long time and going about a business here, but a lot of us, including myself, still have people that still live there. So when I saw the first ambulance roll around cutting trees saying that Ebola has hit Freetown, man, I was sick to my stomach. I know the health condition there, what it is like, it's not very good. And like Jeremiah was saying, the congestion in the city, I was just thinking, man, I hope this doesn't happen, because this stuff maybe will just wipe out the whole of the city. Knock on wood and praise the Lord, that did not happen. And then about 2 weeks after that, I got a call on a Saturday night about 11 o'clock. And it was a Methodist bishop. And he was calling all the way from Ohio. And he was calling for the reason, he called to say that they have brought the first doctor that encoded this disease, this Ebola. I can't remember the name of the doctor now, but Jeremiah, I'm sure, knows the name of that guy, that doctor. He called to say the doctor is here and is in the hospital that they have arranged for. Methodists have arranged for the doctor to come to America for treatment. And they're trying to locate the wife. And I said, have you called the embassy? He said, yes, we have. Nobody's answering. And it seemed like you're next on the list. So I said, well, I'm going to have to grab the ball and get going with it. So I did. I called myself. The ambassador was out of the country that time. And first thing in the next day morning, 7 o'clock, I called the assistants. And I told them the news I've had. And then I think it was 2 days later, the ambassador came back and he called me. And then he suggested that we should form committees. to see what we can do to help. And we did that. From the committees, and not to mention, like Evan said, that when I passed the news on to KDU that this has happened, that they suggest we form committees and raise funds, et cetera, et cetera. And of course, they embraced it. And then I did not only pass it on to KDU, I'm also a member of the Association of Sierra Leoneans in Dallas. I passed the information to them and they embraced it. And at that time, I was also a member of a national group. It's called National Organization of Sierra Leoneans in North Texas. They're based in Washington, D.C. I passed that information there, and they all grabbed the information and agreed that we're supposed to do something to help. We are at a place where we can do it. So we started rallying around. Embassy suggests again, since I was over here, I take care of the whole region, which I did, call different states, call different areas, pass the word around, and everybody was willing to help. Then the first thing now was to come up with a strategy, how we can get it done and get it done properly and orderly. First thing was to talk to these big corporations, talk to these hospitals, talk to the CEOs, talk to the people that dispense the funds. And I did, we sent letters, embassy wrote letters for help us put the letter together, which is sent to us, and we have to put on signatures and send it to these different corporations. And then not only did we send the letters, some of those stuff just go in the bin. So I followed up, and I got some people help me follow up with phone calls 3 days later. They were all very receptive to helping us. They knew the situation that we were in. And so we started raising the money. But the first problem we went into was how to transfer these things from over here to Sierra Leone. The containers that Yvonne mentioned, a 40-foot container costs $40,000 to send. And here we are collecting $10 and $5 and 2 cents, a little bitty stuff. It's going to take a lot of money to come up to $40,000. That's just for one container. The smaller containers, 20-foot container costs $20,000. That alone is a challenge. So we figured, again, we approached a company that they've been sending medical supplies to African countries that needed help. It's Medicine International, as Yvonne already mentioned that. So I approached Medicine International, spoke to the director, and he, of course, knew about it already, and he was helping other countries. So he agreed to help. But of course, he knew the situation we're in, no money to send these things. So he suggested and linked us up with some corporations, again, that will help us. They just want to render the funds. You do whatever you want to do with it. You want to get it off the books. So he linked us up with Chevron. And it was a few oil companies at the time that basically helped us with the funds to ship the company. So the Medicine International helped us with supplies that they have already in their house, I could get from hospitals. And then we had to provide the manpower. You saw the slide that Yvonne sent where we had to fold up our sleeves, fold up the ends of our pants and go to work in the warehouse, big old warehouse. So they helped us get that done. We sent, in all, we sent about 5 containers because we did that one through KDU. We did one, well, through Noslena, but Noslena, we also work with the embassy in collaboration with that because since they're based in Washington, D.C., they collected the stuff and worked with the embassy on the shipping. Even the ambassador had to go to warehouses and pull up his sleeve and do some work at the time. So, but then the shipping part of it, that takes a month to get the stuff from here to Sierra Leone. And they needed these things ASAP, as soon as possible. People are dying by the minute. So somebody suggests that we approach the airlines. I didn't know what it was going to cost, but I didn't know they could help us. But we did. They said approach, we approached. And lo and behold, some of them said they could help, but of course it was very limited. They said they would just take the actual stuff that was needed at that time, and it couldn't be more than a certain weight. So we put that together, send it through the airlines. I think we did that about 3 different times. Then we had 2 organizations that help us out here. That's called, one is Idea, like Yvonne mentioned. The lady there is Betsy Seaborn and her husband. They're very, very nice people. They've been to Sierra Leone and other African countries. They used to walk through the Lutheran church. So they already have that mechanism in place to help get that done. So they work with us. We did some concerts. We did some movies. Just whatever we can do to raise funds. And there's a company, again, even mentioned that company, Restore Hope. They were already working in Sierra Leone prior to this happening. So, and the headquarters is right here in Arlington, in our backyard. We living in Dallas. So I said, well, that's a good opportunity. So I made an appointment with the CEO, Cindy, I forgot the last name now, but anyway, he set me up with the field guy. His name was Aaron Pierce. So I worked with Mr. Pierce to get these things together. They were able to get us a warehouse, 2 or 3 warehouses. So I would stage these things, take them to the warehouses. And of course, then we load them from the warehouses and send them to Sierra Leone. This was, of course, very challenging, but we were able to, not to mention churches. We approached churches, and some of them, like Yvonne also rightly mentioned, they did not have the money they know we're going to need. So they have to go to the board, and you know, when they make their finances, they do it for a whole year. And at that time, there was no provision to give us money. So they collected from the members, and then some of them asked us to come and talk to the church, and they talk to the board also, and they included us in the budget for the following year. So that's how we got the churches to help. And at one time also, at that time, the Olympic was on. So Olympic knew about it. And then I don't know, it was Medicine International hooked us up with those people. And so after the Olympics, a lot of them came to Dallas, donated money for the shipping. Those are the ones that donated for this particular container. And not only that, the Olympians came. As a matter of fact, some of the guys that just competed for America a few days before that, they were here, shoulder to shoulder, putting these things together. One of the guys I made a couple of records that same week, and he was here with us putting boxes together to ship to Sierra Leone. So we had plenty of help, and now again the stuff, from what I understand, is coming back on. Oh, then let's talk about the first case of Ebola that they had in Dallas. A Liberian guy came first. He went to this hospital, Presbyterian Hospital. They treated him, sent him back home, say, "You're fine." And a few days later, they found out he had Ebola. That was another one. We had to work with that. And then we had a local, that's when I got involved with the local press, television, radio, calling for, suggestions. What are we doing and how are we doing it? And then sometimes I was in function season. One time we had a interfaith prayer, and I was in that prayer session, and CBS came knocking at the door looking for me. I came out with some KD members, interviewed. It was on the news the same night. And it was very challenging. People from England calling, press from England and Sierra Leone calling, "What are you all doing?" And some of them were just thanking us for the efforts and giving us ideas, and again, just being very appreciative. And a couple of the issues we have was, again, transportation was the big thing for us. But one thing we found out that when we send some of this stuff to Sierra Leone, if we say we're sending it to the Ministry of Health, regardless of all the stuff we put in that container, for hospitals who are working with, private hospitals, they would not let them have it. They say, once you put Ministry of Health, all goes to the government. So we had to battle our way through that. And when we send to others now, that's when we stopped sending to the Ministry of Health. We started sending it to the individual hospitals and clinics and orphanages that needed help. And that, again, that's where Restore Hope came in. They were very big in helping us get those things done. And again, it was very challenging, and I was glad I was able to help. Also, even happier, I was in a position to be able to be of assistance to my country. So I don't have the slides, even give you all the slides, but I could provide some more for you all later on, because I only had 2 days notice for this appearance. But yeah, I'll stop for now, and you all can ask me any question you want.
Thank you very much, Patrick. Yes, as Patrick said, he had just a few days notice because Miss Rosalind Jones, who would have been one of our panelists, could not make it for the rescheduled time. And the ever generous civic person that Patrick is, he willingly accepted my invitation to do this. Thank you very much to our panelists. As you can see, the pandemic, the Ebola pandemic was not just confined to Sierra Leone, Guinea, Liberia, West Africa, or Africa. It was a global event, and this panel has tackled that to show that indeed it's that. So let's go to questions. I'm not going to monopolize it. I'll just wait to get questions from our audience. Okay, how do I get to the questions? Are there questions in the chat? Okay. Okay, we do not have any questions submitted, I am told. So you have time, those of you who are in our audience, you have time to type your questions to the chat room. But while you're doing that, I could ask questions. I have many questions to ask our panelists who have made such interesting remarks. Let me start with Jeremiah. Mr. Hardin, how successful were the campaigns, the public education campaigns, those posters, those billboards that were up there? I like the image of the billboard where we have people just walking beneath the billboards, you know, just going about their businesses. I take it that people, of course, read those billboards, but how successful? Did people really listen to these things? Did they change their lifestyle because of the information they got from these billboards?
Thank you again for letting me in. And I can comment that they were quite enough to even get us to where we have.
Jeremiah, maybe, okay, deactivate the video. I was wondering if you deactivate the video, if it will, because you're freezing on us.
Yeah. In Freetown and even in the wider Sierra Leone, where it is even challenging for vehicles to go to, or even to get them informed in time on some certain materials or some certain awareness. So the billboards were placed all over. And added to the billboards, we are also these jingles. And the beautiful aspect of the jingles was that most of them were done in local languages, in the local dialect of the people, and they were recorded and played repeatedly. So even if you happen to go to a place where the residents cannot understand your dialect, then it is even easier to just play the jingle for them. And so when everybody was glued to their radio again before listening to the Ebola report, by the end of the day, these jingles were played. And so the jingles were getting right into the heart of the people. And not only the jingles, but there were TV recordings, some audio-visual recordings, where they will show the nature at which they will bury the dead, the Ebola disease. And so when you look at that, you as a normal human being, you will be afraid. You will be so emotional to see people being bundled in bags and being thrown like that. You cannot see your loved ones. And so everybody was like saying, do you see what is being broadcasted in the radio and on TV? This disease is real. It is being spoken of often. And even what we are seeing now in terms of how they are burying the dead, I don't want my loved one to be involved in this. And so these jingles, we are going right across the four corners of the country. And so they helped a lot, because to be honest, there are places where these medicines or these vaccines or Ebola treatments could not reach. And so when these people we are listening now to the jingles, to the audiovisual recordings, I think it was more of a preventive measure rather than a reacting measure or a treatment measure, because they were able to control it now in the provinces where medical facilities were poor. There were little or no equipment to even handle the Ebola patient. So they were more in control of everything than having it in the main center. So it was really serious. It was really necessary that we had those recordings.
Great. I see the questions coming in now, so I am just going to shelve my own questions and go to the questions from the audience. Would you say that efforts to curb the spread of Ebola many years ago contributed to a lower prevalence of the COVID virus in many parts of Africa? So this is a question for any of our panelists. Any of you can take that on.
I think I'll go ahead and help with that one. Yes, I think I would agree with what happened when Ebola came and where we are now with COVID. I would say, yes, it is COVID, look at it, even though, well, it's almost in the same scale of mortality rates, as far as killing people. So, but one thing we have going for us, we have that experience from Ebola, because it started in Central Africa, and when it started there, nobody paid attention to it until it started spreading to other African countries. So, of course, the COVID, we have that experience in a bag already, how to handle that, what to do, and how to do some of it, although the different disease, different sickness. But that now, and again, like I mentioned earlier on, a lot of African countries, the health sector was not well developed. And after that, the international community paid attention to helping them develop things, and develop the medical facility, build hospital, field hospitals, et cetera, et cetera. So with COVID now, we already have that to work on. We'd have to go to square one, and most of us were not caught flat-footed. So I'll agree that yes, it is, make COVID a lower prevalence, even though it's just as deadly.
Yes, indeed. As a historian, I can tell you that often history is the best teacher, and people gain experience from history. And another question here, and maybe Yvonne can take this on, given that KDU collaborated with other groups to send supplies. The question says, did the Ministry of Health act regarding Ebola? Do you lose the medicines and supplies sent to Ministry of Health? So Yvonne, how did you keep track of what was going on? Did you hear about what happened to your supplies sent to Sierra Leone?
Yes, as Honorable indicated earlier, that was what we never wanted to happen was happening. As these supplies were being sent through the Ministry of Health in Sierra Leone, we started losing track. We did not know where things were going, therefore we had to find other ways of reaching out to the people so that these supplies would go where needed.
Anybody wants to add to that? Jeremiah, what were people saying about the Ministry of Health getting these supplies? Those of you in Sierra Leone who were literally on ground zero, what were people saying about accountability with regards to the Ministry of Health?
Well, I think they had their own way of doing it. And so whenever they receive such a donation, whatever the prescription or the directive will have been, they will have to put it in a way that will suit them. And of course, one will understand that they are the head of health issues in Sierra Leone. And so since they are on the ground, they can do whatever they think is necessary, look for areas where the need is great, and then supply. But again, the the donor or whosoever sent those products will have been happier had it been that they communicated to them every step of the way. But most times, even those that are receiving the products will not know that these products came directly from this particular organization, or these were the people, for them to acknowledge at least that there are people over there who made those donations. But they will just claim the credit and just give out the medicines without even mentioning the donor. So I can feel the pain of Madam Yvonne Dean, and it's just a sad reality that that is exactly how it happened.
Okay, yes.
Well, if I would add to that, Miss Professor, one thing I noticed also that I get to find out after this was just about over with, that they still had containers and containers and medication and office and hospital supplies still packed at the key, you know, the shipping key. There's still those left over there. So what I thought happened is when Sierra Leone started getting all this help and all this medication, they did not have the infrastructure of how to dispense them. So they just keep piling them and piling them and piling them. And so, well, maybe it's a lot better now, a lot improved now. Mr. Jeremiah could probably help me. I'm sure he heard about this issue before. So I'm sure, you know, by this time they would have taken care of that. But that turned a lot of people off. That basically turned a lot of people off. So when this COVID, we had this issue of COVID, and the embassy called back again, need to raise funds, and we formed this committee. A lot of the people in the committee did not want to donate them money because they were not satisfied with how the last one went. And they were asking, again, accountability was a problem.
Honorable, I will totally agree with you on that. And to say some of these vaccines or medicines are sitting somewhere in a hiding place, I cannot attest to that with evidence, but I believe it is possible, because let's say probably these medicines or these vaccines were sent and they became so enough to even treat the available, the infected people. And so when it was announced that the disease is no more in Sierra Leone, probably they would have kept them for any other reasons or any other spark of the sickness. But I don't know whether they are still there, but it is possible, like you're saying. And there's a comment I want to make. There's a question I want to respond to when it comes to the efforts that was put by the religious leaders, community people, that it was a consolidated effort. It was a collaborative effort. So I cannot sit and off my head just name every single person or every single organization or entity that actually puts their efforts together to support the curtailing of this disease. But community elders, community chiefs, the honorables, the councillors, it was everybody's business. It was everybody's responsibility. So just imagine, for example, honorable, the Creole Descendants Union, these people are over there. They were quite kind of okay, though their loved ones were here. But for the fact that they made the move to even provide that support, how much more so someone living here in the situation. So it was a collaborative effort and everybody was involved, including the government. And so we are talking of this now, we are speaking of this now because of everybody's efforts. And when once that, for example, we are on the 15th day and they say there is a case, it's like everybody wants to find that patient and kill that patient, because we are also tired of this disease. They will just, hey, another case again today, and they will start again, start counting. So everybody was interested, and everybody's efforts led to what we are enjoying today. Though we are in the COVID-19, another new disease, but I think the Ebola went away because of everybody's efforts.
So Mr. Haddon, in fact, has started responding to the other question in the Q&A chat. Can you speak, that's the question, can you speak a bit about where trust lies in Sierra Leone? Jingles were mentioned, and let me just say in terms of the jingles, when I shared my screen, I didn't realize that the sound wasn't on so that you could have heard the announcement on the radio. And I'm not so sure we'll have time. I would have played it again, but it's important to get the questions in. So I'm still reading the question here. Jingles were mentioned, for example, as important in communicating to people. I know it varies in communities, but what kinds of institutions / community leaders were most effective in building trust? Radio DJs, church leaders? So that's the question. And it's a question for all three of you, because even those of you in the diaspora building this community for assistance, you know, who were the people, who were the intermediaries, who were the people going out there to encourage people, to persuade people to support the cause? So any of you can take this question.
I can say a little bit. Over here in the diaspora, I know that because of the interest that we have in our country, as soon as we get health information, as soon as we get any pertinent information towards Ebola that would benefit our people, we send them through emails, we send them through WhatsApp, we call our people to alert them, to tell them, do this, don't do this, don't do that. So, and we know, we go through our contacts list and we send all these messages to other people, and we know, we ask them to forward these messages. And like Jeremiah said, if people were not listening, if people were not reading, they would not have been responding to make Ebola disappear the time it did in Sierra Leone.
Yvonne, who are these people that you send it to? Health workers, community leaders, church ministers? Who are these people who serve as intermediaries?
Well, for example, here in Dallas, we have a community list of everybody, an email list with everybody, and we have about 10 or up to 15 organizations here, and they all belong to this main group called ASLOT, Association of Sierra Leone Organization, here in Dallas. So when we send it to that group, leaders in that group disseminate it to their various groups. We have schools, alumni, old girls, old boys association. We have church groups. People belong to non-profit organizations. So that's how it goes out. So people from all walks of life, even to people that we have on our contact. Like I said, in my job, I have emails and texts that I send to my friends at work, Sierra Leoneans and non-Sierra Leoneans, so that they could help us spread the message.
Okay.
And one
like
of the
we're running out of time. So
I'm sorry to interrupt. Could I point the panelists and our chair to, there's one question that popped up in the chat function rather than the Q&A, and I can just read it on the, oh, okay, apologies. Go ahead.
There's that one question, and I was trying to get us to get to that. So it says, it seems like what is of paramount importance in the case of a deadly viral outbreak is the speed of the public health response. What can we do as partners to be ready for an ultra-fast response next time? How has the public health response assistance from the USA been better or worse than that from China?
I can tell the first part of the question, which probably is directed to Liam Hai. One thing that I would recommend or suggest is for us or partners not to wait until there is a crisis. And in order for us or partners to prepare themselves for such outbreak, it is better that we always put together plans. Let's say, for example, organizations will have a fund basket or a particular aspect of their budget that will be put aside just for crisis. Because if we still wait until there is a crisis before we start putting things in place, then by the time we'll have finished the planning aspect of it, the disease will have been worsened. For example, the COVID-19 took everybody by storm. And so we are experiencing now what's exactly it's doing in the world. So had it been that there were mechanisms in place, for example, we get the Center for Disease Control in America, you have other organizations that are there to support or that have the capacity to support. Don't wait until there is a crisis.
And very quickly, and I mean very quickly, because we are really at the dot, we are at the time now. Very quickly, what about the China factor? Comparing these two great powers, and given China's role in Africa, I guess the audience wants to hear something. So there's also that question in the two-part question. Who or what country is better at response in Africa in terms of the Ebola crisis and possibly the COVID-19 crisis now? China or the USA? And
China.
Okay.
China is more rapid in terms of helping Africa. And even as we are speaking, last week or so, there has been supplies about how many feet of containers coming in with vaccines, about 200,000 vaccine of the COVID-19 vaccine in the country. So they are very, very swift in terms of helping Africa or responding to disease outbreak in Africa, and even in other aspects.
Any more comments? Because this is it. This is it. Thank you very much to my panelists. This has been a wonderful panel that we can go on and on. At least what we have taken out of it is that this is a transnational story. This is a global story. This is a story that cuts across class, across ideologies, across ethnicities. Thank you, Yvonne. Thank you, Patrick. And of course, thank you, Jeremiah, who is approaching his bedtime, given the time in Sierra Leone. We have just started our day in Texas. Thank you very much.
Thank you for having me.
Yeah, thank you for having me. I was glad to be a part of it. Thank you. Next time, give me more notice.
And I think Jessica wants to say something. Don't leave yet.
No, I'm just thanking Professor Johnson for facilitating this panel, and to our three panelists for joining us. And we hope that our audience members are able to return for the 3 p.m. keynote address. Thank you so much.
Thank you all. Bye-bye.
Yeah, bye-bye.
Bye.
Thank you. Yeah.